So pleased to join you. And I just want to give us a little perspective. When I was preparing my presentation this afternoon at 1:30, so 13:30 on 31 May, there were 7,950,766,760 people on the planet. So let's think about that. Let's think as we go forward and make this presentation and all the presentations at this conference to realize that every single day, about 250,000 new people arrive on the planet. Most of you are quite young. Some of you are students or early career faculty or early career in industrial or ministerial jobs. And you know that there are 8 billion people almost, as we see. By 2050, there'll be 10 billion people on this small planet. It's going to be a challenge for us. So it's so important that this conference was organized and other conferences like this, because this is a big problem that we're going to have to face. And we have to come up with a way to look at it realistically, practically, and most importantly, find solutions. So it's your problem, not mine. By 2050, Ajahn will have been dead a very long time. So this is your problem. So my dear students and young researchers and young policymakers, let's talk about what you might do. So as we do this conference today, we're going to review the risk paradigm. We're going to talk about what the risk assessment process is. And we're going to look at how it's used and described and give some examples in the food production system, since that's what I study. And we'll give examples from Thailand and other examples in Southeast Asia. And then finally, look at some non-agricultural exposures and see how they factor in as well. So let's begin. So in 2022, we have to use a different approach. We use a risk-based model for our assessment and response. So my instructions from the host was to ask to talk about biological and environmental approaches to problem solving. And so we use risk analysis. Risk analysis has three important components. Risk analysis has the risk assessment, hazard ID, hazard characterization, hazard assessment, and risk characterization. Then there's risk management. So you did the science, you said, okay, I got a problem, or okay, I have an opportunity. Now what? We have to do policy. How do we evaluate this and come up with a management option? How do we make this management option an implementation? And finally, how do we check it for success? And all of us are responsible for communicating the risk, communicating the alternatives, communicating the solutions. You know, sometimes in science, scientists, as we say in English, like to hear themselves talk. Scientists will talk to other scientists and make pronouncements or do an evaluation or present a problem to people, but they won't make it clear. I always tell my graduate students, explain this problem to me like you'd tell my mother, because I want her to understand the problem. You don't have to explain it to me. I'm your teacher. I already know this. Tell me how you tell my mother how to look at the problem and how to solve the problem. So these are the three elements: risk assessment, management, and communication. And let's look at some examples and try to see if this actually makes sense to us. You know, in all aspects now of production, of product, of consumption of product, and of application, there are risk-based approaches. So we have for farming, and of course, food production is such an important part of Southeast Asian economy, particularly in the Kingdom of Thailand. We have pesticide risk assessment. In manufacturing and industrial processes, you see the same. These are all textbooks that are fairly new. And here you see integrated life cycle and risk assessment for industrial processes and products. 20 years ago, a book like that didn't exist. Now there are many documents that tell us this is the way that we guide our decision making. This is the way we project what the new problems are. And during this time of COVID, we have risk assessment, okay? And people tell you, what is your risk for certain activities in COVID? So this comes from the Texas Medical Association, and it goes 1 through 9 and tells you what's the most risky. What's the least risky? People need a very straightforward indicator. Typically green tells us things are good, red tells us things are not. And so this is just some example. They give you low risk, low moderate, moderate, moderate high, and high. And so they tell you, during this time of COVID, if you go to the mall, you're going to be at risk. If you swim in a public pool, you're going to be at moderate risk. Those are moderate risk things. Low risk things are pumping your gasoline, playing tennis, or opening your mail that comes in the post. And high risk are things like going to a sports stadium, working out at a gym, or going to a bar. So we have, in many respects, taken this very applied approach and we've overlaid it to occupations, to manufacturing, to military, and even how we do our personal lives during the COVID pandemic. So let's look at our problem statement. So my instructions from the organizers were to look at environmental and biological problems and solutions. So as I mentioned to you, we have 8 billion people now. We're going to have 10 billion people soon. How do we feed them? That's a practical question. How do you feed people? Right now on the planet, with these 8 billion people, there's about 1 billion people that are undernourished. Okay, we see some of that in Southeast Asia. We see most of that on the African continent, a little bit on Indian continent. In 2022, we also have almost 2 billion people who are obese, who are unhealthy because they're overweight. Okay, pompoi. We have people that are just great risk to cardiovascular disease, to hypertension, to type 2 diabetes. Think about rural people in Thailand. You go to rural communities in Thailand and you go out in the community, all of a sudden you talk to the health clinics and they tell you, oh, Ajahn, I have a large number of people, maybe 50% of home visits are people who have stroke or type 2 diabetes. And it's not clear because you look at Thai people and Thai people still follow pretty much a plant-based diet. Most Thai people in rural areas are not overweight. No, but yet we see these high risk. So this is a challenge for us. So we have to produce more food. We have to do it with the tools we've been given, which include pesticides. So we're going to give an example of that. And we have to take this risk assessment process and see how it's going to solve complex problems with practical solutions. It has to be a practical solution that you can implement. When people said, when COVID started as an example, oh, you have to keep 6 feet apart. Yeah, right. As the kids, the students say, how you keep 6 feet apart. The concept of 6 feet apart is very strange to Americans and very strange to Thai people because, when you're on the BTS, when you're in the shopping center, when you're walking down the street, if people were 6 feet apart, no one would move because it would be impossible. So let's look at some examples now. And the reason I picked food is because all of us eat. Americans eat about 3 times a day. And I always tease my Thai graduate students at Chula and at PSU that I could never have Thai children. I have many adopted Thai children, including Payung. I have many graduate students that I consider to be my own. But I said I could never have Thai kids because they eat 5 times a day. They eat too much. I couldn't afford them. But Americans eat 3 times a day. Thai people 4 or 5 times a day. Everybody eats, and there's about 1 billion people in the agricultural sector right now, and that's quite a bit fewer than there were before. So the agricultural sector is a big sector. Sometimes people describe them as informal workers, sometimes as formal workers, but we have a big sector. We have to take care of them. And in the Thai situation, there was the idea that Thai farmers were going to export more rice. Do you know that of the 8 billion people on the planet, 4 billion people get some, if not all of their calories from rice? Think about that. Half of the planet gets their energy source from rice, the carbohydrate source. So we grow more rice and other food too, but rice in particular. Rice is popular in South America, in India, in Africa, in Asia, and even in parts of the United States. So, it's a big commodity. So the Thai government said, we're going to go ahead and we're going to encourage our farmers to grow more rice. There's only so many paddy fields. We have wet rice, 3-season rice, and we do have in some of the northern provinces some dry rice, 1-season rice. But it's important for Thai agriculture. How are we going to increase rice production when we don't have any more place for paddy? And so one of the things that people have done, of course, is increase the importation of pesticides into the kingdom. And from 1994 to 2005, here's just a snapshot, it increased by a factor of 3. You can just look at the green line and see total. So this is for herbicides, fungicides, and insecticides. And if you look in the picture on the right, you see the farmers in the rice paddy. These particular farmers are spraying something called chlorpyrifos, a potent neurotoxin organophosphate insecticide. And when you watch this, you see very thorough application of the pesticide, but you wonder what the health risks are. What do we need to do to protect the workers? So the Ministry of Public Health, through the Bureau of Epidemiology, wanted to look at these numbers. And they said, oh my goodness, look at this. There has been an increase, a steady increase, then a little bit of drop in 2005, 2006, but then back up again of pesticide poisonings in rural people in Thailand. Who were the people that were exposed? Well, there was a large number 0 to 4 years of age. And then from 5 to 14, not so much. And then back at 15, we see the number increase again. So I always like to ask my American students who don't know a lot about Thailand, what do you think is the reason that 5-year-olds to 14-year-olds don't have the same level of exposure and poisoning that somebody 0 to 4? And they think and they think and they think about it. And then finally everybody goes, oh, they go to school. So school becomes a protective factor. About 15, some students, especially in rural parts of the kingdom, stop going to school. They go back out and work on the farm. So you can see the progression of people that were exposed and what age groups. Now, there was a period of time when the government stopped collecting some of this data. And in 2003, 2004, 2005, it wasn't really collected. And so, the problem still was there. Just the data wasn't collected for whatever reason. Government started to collect it again, and you can see it's almost like the number continued to connect. So we see this is an increasing problem for Thai rural people, for farmers who are the backbone of the Thai economy. So now the practical part, now the part that goes to the question the organizers asked, which is, how do you relate this to environmental and biological problems? You say to somebody, what kind of PPE do you use? Personal protective equipment. And so here's a farmer that was in a study we did a long time ago, maybe in 2003, down in the southern part of Thailand in the Songkhla province. And we said to the farmers, what kind of PPE, personal protective equipment, do you use? And number one answer, by the way, was none, which would also be number one answer in US. Chemical protective mask, normal mask or cloth mask, and then knitting faces hat. And the English translation from the Thai, because he had to put it in English for me, Ajahn Nitnoy Thai. When people say, oh, Professor, my Thai Thai, I always have to just say Nitnoy. I don't speak it very well, but just enough to know when you're gossiping me. And so I looked at this, and then I realized what the farmer was using. He was using this cotton ski mask, and this was his idea of protective clothing. So, it has to be practical. The biological and environmental approaches to problem solving have to be practical. Someone said to me when I gave a presentation in New York one time, showing some of the data from our Thai work, they said, well, how about Tyvek suits? I said, Tyvek suits don't work in a place that's so hot. So when it's too hot, that's never going to happen. So you see, these are the tools the farmer had. But how do you help him and her make it real? You have to have real farmer training, opportunities. This is the practical part. You did the risk assessment. You said, okay, there's a problem. Yeah, but that's the first part. The second part is the harder part. Risk policies and risk communication. Explain to the farmer what the risk is. So bring the farmer into the health clinic, have them build little dioramas, show us how they run their farms. And then we can help them come up with a plan based on where the risky part is to go ahead and reduce exposure. And of course, celebrate the training of the farmers, make people feel part of the process. That's part of risk assessment too, to get people to, as we say in English, buy into the process, become part of the solution, not part of the problem. So you have to look at the real risks, where when you talk about biological and environmental, you have to pick and prioritize. So where is the risk? Interestingly for us, when we looked at this, and this is some of Ajahn Watasit Siriwong, Ajahn Watasit is now at Chulalongkorn at the College of Public Health Science. But when Watasit was PhD student a long time ago, we looked at what was the exposure to the farmers who were catching the fish. They were growing rice, but also in the clogs catching fish. And we found out the risk was not the rice paddy. The risk was when they were in the clong catching the fish. You have to look at where is the real problem when we look at a biological problem. And so we wrote some pretty interesting papers to look at this. But what did we need to do first? We needed to go out and watch people fish and ask them how they fish. You cannot be a good researcher and do good biological and environmental research if you sit in the office all day. You have to get up, you have to get out, you have to go out into the village, you have to go to the clong, you have to go out into the water and see how this all takes place. So we asked them, how do you catch the fish? And they showed us. We asked them, how do you eat the fish? And they showed us. How much fish do you eat? And this was interesting. This is again where you have to get real data. It's a common answer all over the world, whether you're in Europe or North America or Southeast Asia. People underestimate how much they consume for food. They usually say, oh, not so much, maybe this much, when in fact it's more. In the examples in the United States, I talked to our nutrition department before I went and started this work in Rangsit in Thailand. And they said, oh, Mark, you should assume people will underestimate their food consumption by 300%. In other words, you eat a lot and you only report a little. I said, okay. So we had many families that we followed for 2 weeks, gave everybody a scale. We measured their food. We paid them to participate. And interestingly, at the end of 2 weeks, the average underestimation, about 300%. So Thai people, like US people, probably like French people, very much like African people. People underestimate. You have to have accurate data. If you don't have accurate data, you can't tell a good story. The other thing that's important when you do biological and environmental research is you look at what we say are sensitive or vulnerable populations. Some of you might know Ajahn Chittachai Petchute, who is at Ubon Ratchathani. And so she was also a PhD student of mine at Chula. And we looked at children's exposure. When you try to look at a problem, and we were busy studying the farmers and doing risk assessment, I looked at the edge of every field where these beautiful little kids, healthy, happy, beautiful kids. But guess what? They're much more at risk than the parents. So we did some studies on the children. And surprisingly, we found that the children who lived in the community that weren't involved in farming didn't have such much exposure. But the children, when we did the risk assessment, who were with mom and dad, had high exposure. Now, when you do good environmental and biological studies, you have to find something practical. You're not going to be able to get a lot of blood samples from little kids, but you can get urine samples. And so here are dialkyl phosphate metabolites that are creatinine adjusted. And we looked at who was exposed. And you see on the left side of the frame, this is during the growing season. The light gray bar are those little farm kids with their parents. We had about 25 or 30 kids in each, in the control and in the cases. During the rainy season, when the farmers didn't apply pesticides in that area, the dark bars, city kids, village kids, and the light gray bars, farm kids, the same levels of metabolites in the urine. But during the growing season, when it was dry, you can see very high levels of metabolites. So when you do risk and you try to make a difference, it's great to have lots of data. It's important to publish papers. Many of you who are going to take this workshop are in academic. And, Thai has very high standard. Most of Southeast Asia has very high standard, but especially Thai, for getting good papers in high impact factor journals. So as good scientists, you write lots of papers. That's good. But you have to write papers that make sense. You have to write papers that are applied. And so this is some work by Bupa. And so Bupa went ahead with Ajahn Surasak, Ajahn Wadasit, and myself. And she looked at programs where the children can actually help the parents understand the risk. And you see the cartoons there on the right. We made coloring books and guidebooks to encourage the children to work with their parents to reduce the risk. If you want to impact the parent, you get to the kids first. That's a very important entry point for policy change. One last example this way, because I want to be on time for my 15 minutes, is this is a study that we did up in the north. And we looked at KAP, knowledge, attitude, and practice, in maize farmers. And again, maize farmers in the north, they grow it in communal style farming. And in this particular case, we had over 400 maize farmers. And we went into the village. This is Denpeng, and Denpeng was our PhD student at Chula. And we went into the community and we worked the farmers to see what the KAP situation was. And then we put in a program to have practical kinds of PPE, something that was going to be meaningful, but at the same time, something that could be manageable. Okay, that's the important part, not just meaningful, but manageable and affordable. And you can see we did demonstrations to help farmers understand how they could reduce their exposure. And we had a public education program where we went into each home and put a poster. Now you can see Denpeng was the tallest Thai graduate student I've ever had. He's probably, 12 inches taller than Ajahn, very tall boy. And the people liked him. And he was very, very personable and articulate. And he got each home to put in a poster, each maize farmer. And so the farmers looked at this poster and thought about how to reduce their exposure in a very practical way. If it's not practical, then it doesn't have a meaningful outcome. So we did all this work. We've been working in Thailand. I've been working in Thailand for almost 30 years. And every once in a while, we'll write a paper in a good journal about policy and invite all the people who have participated in our work to participate in the paper. So here's Ajahn Parin. He is at Emory University in Georgia, but he is Thai-born. And then, of course, Ajahn Wadasit from Chula. Ajahn Tip is from Chiang Mai. And then a bunch of Farang that work with me in the United States. And we put together a policy paper in the environmental science policy to write about how you take all these good ideas and put them into practice. In the United States, there's an expression about do not hide your light under a bushel basket. In other words, if you have a good idea, share it with someone, explain it to someone, put the idea implementation. Research for the sake of research with no practical application doesn't help the population. The last part of the talk, because we're almost done, is to remember what happens when you do things around biology and environment, is to remember that you can be surprised, to remember that you have to understand when you didn't get it right. And we say in English, the humility to learn. So this is an interesting one. Down at PSU, Princess Songkla University, Dr. Alan Gator and some of the team there. Dr. Gator is a British-born epidemiologist, but on the faculty at PSU. They were looking at a lot of this skin conditions, dermatological conditions, including cancers. And, first, maybe it's pesticide. No, it's actually naturally occurring arsenic. And, people, they invited me to participate and right away say, oh, must be pesticides. No, it was not at all. It was naturally occurring arsenic. So you see the hypopigmentation on the back. You see the lesions on the back of the person in these palmar-planar keratotic lesions. We went into villages, and in the villages, we saw wells with almost 1,000 parts per billion. The standard for WHO says 10 ppb. In New Jersey, where Ajahn lives, 5 ppb. But some of these red dots in this village were as high as 1,000 parts per billion. So these are real conditions, not an exercise. These are real. And you look at water and exposure and you say, okay, in a biological system, where is water play? You drink water, you cook with water, you bathe with water, you wash the dishes, you wash the house. If there's something in water, that environmental exposure is going to impact everything that everyone does. So we have to get a new water source. The new water source is without arsenic, but it's very deep and it requires specialized equipment and specialized training to pipe the water in. It's all workable, it's all doable, it all costs money, and it all requires cooperation. And once again, when you finish the research, it's time to write the papers so that you can go on record as a bright young Thai scientist that you have these papers and that you've demonstrated that these are some of the risks going forward. So this is my example for you, and I want to summarize this with 3 points. The first point is that as we go forward, new challenges, which is why this conference is so important, we have to think differently. Okay? For many years, we did research in universities to do research. We didn't apply the research. We have many more bright young scientists that have very sophisticated methods. We need to help them. We need to mentor them to do the science, but take the science and implement it. The second thing is science is expensive. So we need to have a risk base to prioritize what science we're going to do first. There's lots of problems. There isn't a lot of money. So you prioritize things, you know? If you're trying to have your house fixed, what's the first thing you fix? The roof. Why? Because we want to keep out the rain. Okay, later on you can go ahead and put on fancy doors and put on a nice floor or carpet. But the short term, you fix the roof. In science, you do the same thing. You go after the big problems and you tackle them first. And the third part of this is that you cannot have the luxury anymore of just deciding to do a project because it's a good idea. You have to have a reason for it. You got to go back to that risk assessment paradigm. In biological and environmental problems, like all problems, you look where the risk points are, and then you look for ways to remediate it. If the project is one where there is a problem with a food product, then you need to understand how much of this food product people eat. You know, for those snakefish in that picture a little while ago, we found that there's one particular part of the snakefish, internal organ by the liver. If you remove that, you remove most of the contamination. You're not going to get rural Thai people to stop eating snakefish. They're going to tell you, forget it. But what you can do is teach them when they prepare it to remove this one organ, and that will reduce the risk. And it's a practical way to keep people happy, to still have good protein source for them, but to still limit the risk. I want to thank you for the privilege of talking to you today. I hope that you found some useful information in the presentation, and I welcome you to send me email questions or talk to Ajahn and he can send me the email question. Thank you very much. Kapun Kap.